Yeah, well, I guess it started on day one. On January 20th, Trump issued an executive order freezing all foreign aid. And I remember reading that and thinking to myself, this must be a mistake. That would mean interrupting clinical trials and shuttering health clinics that were open yesterday and interrupting emergency ambulance services. It would have resulted in a lot of people dying. So I just kind of tried to hold my breath and say, wait, there's a mistake here and this will be clarified. But unfortunately, things got only worse from there. I think 5 days later, Secretary Rubio did issue some supplemental guidance, and then it was clear that my worst fears had actually been confirmed. This was how the first week of the Trump administration began to unfold, and the way that it ended was even worse than that.
Welcome back to Unsung Americans. Took a little hiatus there for a couple weeks, but glad to be back. Our podcast showcases frontline American aid worker stories from the fields, talks about what USAID actually did on the ground, what the world of USAID looked like, and all the good we did for the world. Really pleased today to be joined by Nick Enrich, who is a New York Times bestseller, wrote a book about exactly what happened to USAID at the end. Really excited to get into that and kind of talk through it, hear the story, Nick. Thanks so much for joining us today. Maybe you could just start out by introducing yourself, kind of where you're from, how you got involved in the work.
Yeah, thanks so much, Alex. Really happy to talk with you today. So I became interested in working for USAID many years ago. It was actually in a college study abroad program that I did in Kenya. And this was back in 2003 when the HIV epidemic was very much raging in Kenya and neighboring countries. And as part of my program, kind of went around to health clinics, orphanages, religious groups, and saw kind of the extent of what was going on with the epidemic. And actually, while I was there in May of 2003, at that same time, President George W. Bush actually enacted the President's Emergency Plan for AIDS Relief, PEPFAR, which, as you know, is one of the most consequential global health initiatives in human history. And so it was kind of like something clicked for me as I was there and seeing my government kind of recommit itself to this fight to make the world a healthier place at a time that I was sort of looking at how could I maybe myself get into the fight. And USAID was absolutely on the scene when I was there. As part of my program, we would go to, I think, a few meetings that they'd held and would see the logo on the wall. And even then, I felt a lot of pride kind of seeing the logo and knowing that this was the official policy of my government to be investing in making the world a healthier place. And I was excited at that point. It kind of dawned on me that this is how I wanted to get involved in that battle.
Yeah. You were talking about that massive investment, but when we talk about the return, my understanding is that PEPFAR program over the last 25 years, I think saved 26 million lives. Is that at least the range, the number that you understand too? And you would know this better than me. You worked on the health programs and I didn't as much, but.
That's right. 26 million lives from the PEPFAR program alone. It's really just a staggering impact.
And a program that was it was led by George W. Bush, President George W. Bush and the administration at the time, which was Republican administration. And I don't want to belabor this by any means, but it is really unfortunate how politicized USAID has became in the last year and a half. How much the current administration politicized it is actually the more accurate thing to say. Because in my experience, I didn't work inside of USAID for the most part. I was on the implementing partner side doing the work, but I never found it to be particularly politicized. I don't know if you did, but I'm curious if you did actually.
No, my experience was the same. I mean, the goals, I worked in global health while I was there, and the goals of the global health program were very non-partisan, frankly, I should say, of trying to increase global life expectancy, improving access to quality health services. I mean, these were not things that were political battles. And in the course of the 12 years I worked at USAID, it definitely did not feel like a political organization at all. I mean, it was started by a Democrat under the Kennedy administration, but the investment was vastly increased under the Reagan administration. Of course, in the Bush administration, there was the PEPFAR investment, as we've already talked about, and even in the first Trump administration, there was a lot of support for global health and foreign aid programs as well. So I also found it really surprising that now USAID is considered to be this kind of like political lightning rod when, up until about a year ago, that like it was really not. It was really a non-partisan and really crossed any sort of party lines. It really didn't even have a political aspect at all.
Yeah. That was my experience. That was my experience too, frankly. But maybe we move over to or move forward to your kind of timeline. How did you end up at USAID, and then we can get into what in the hell happened a little over a year ago.
Sure. Yeah. So I started at the agency in 2013. I actually came in, I was trained as a lawyer, which is very unusual for the Global Health Bureau at USAID. It's mostly staffed by global health experts and technical experts, medical doctors, epidemiologists, public health experts. But in addition to being a technical hub for global health, the U.S. Agency for International Development also moves a lot of money, and that's how we accomplish our aims. And so my job was sort of to come in and be the expert of the procurement rules and the federal regulations, and to ensure that we were designing our programs in a way that were achieving the goals that the technical experts were setting, but in a way that was ensured that we were sound stewards of taxpayer resources and working as efficiently and effectively as possible within the bureaucratic constraints of moving federal funds. And so I love the job. I thought I really enjoyed it. I was working initially in tuberculosis for several years, and then ultimately became the director of policy programs and planning for the entire Global Health Bureau, where again, the job was primarily to ensure that we were effectively and efficiently using the taxpayer resources to maximize our global health impacts. And that's where I was when Trump was elected for the second time in November of 2024.
Yeah. So let's go into what in the hell happened, right? Well, and actually, I should back up for a second, because this is where your book starts at this point in time, 2020, well, early 2025, and your book is Into the Woodchipper, right?
That's right. My book is called Into the Woodchipper, and it does start a little bit like right after the election to kind of talk about what it was like as we prepared for the Trump administration to come in. But primarily it focuses on the 42 days from inauguration until I was removed from the agency, that I'm sure we'll get into, and kind of like almost a day-by-day recounting of what was going on inside of there. But maybe I could start by kind of like trying to set the scene, if that's helpful. Right. Trump had been president before. I had already worked under President Trump at the U.S. Agency for International Development, but the question was, how different was it going to be? And there were signs that things were going to be different. For example, what we were hearing on the campaign trail from Trump and his team, like especially Russ Vought, about kind of this animosity towards federal employees was concerning. Right? We were being considered the deep state. We were these faceless bureaucrats that were apparently standing in the way of his agenda. And it was worrisome to think about what it was going to be like, where our new boss was, basically saying that he wants to traumatize us and potentially make us not want to come to work. We didn't know what that would look like, and was a little scary. But again, where we worked in global health, we didn't feel like our programs were particularly at risk. These were bipartisan and long-standing objectives that even the previous Trump administration had no issues with. And the first thing we do, and this is for any administration when we find out who wins the election, is we start to research what are their policy priorities for the agency, who are the people that it might be coming in, what might they want to be doing, so that we can be prepared to to lead the agency in the direction that they're heading. And so the first thing we did, read Project 2025. We thought that would probably set the stage for what they were thinking in terms of global health. And there was I think a 28-page section in that document about foreign aid, and it was surprisingly positive about the role of USAID in foreign policy and national security. There were some there were some criticisms, especially of how the incoming administration was looking at the Biden administration's priorities. But overall, there was nothing to hint at the administration being destroyed, for example. And then when we learned that Secretary of State was going to be Marco Rubio, we especially let out a sigh of relief, because this was a person who was one of the staunchest allies of USAID and foreign aid throughout his career in the Senate. I mean, you can go through a series of just glowing remarks that he's made about how USAID very efficiently and effectively advances American interests abroad. And so we really felt like, okay, this is going to be a relatively safe period. The last thing I'll say that was a little bit different was we knew also that there was this Department of Government Efficiency coming in. And I will say, again, quite naively, that the idea to me of an outsider coming in to take a look at how to make government more efficient didn't sound like a terrible one. And again, part of my job was to figure out how we could get more efficient. And so I actually had a list of the things that I wanted to do to make the agency more effective during the next Trump administration, that I was actually looking forward to sharing with the Doge team when they showed up. And of course, never actually got the chance. I didn't want to see any list and didn't really care what we were doing. But that was just to set the stage of what we were thinking as January 20th and the new administration approached.
Yeah, the interesting thing there, my quick reaction to the efficiency question is I don't know people who are more opinionated about the need to reform and, frankly, just on an ongoing basis, look at how the work is done and then make it better, make it more efficient, make it more effective than aid people across the whole kind of workforce, not value chain, but spanning the spectrum of the workforce, from senior USAID people to people in Washington, D.C., in the headquarters, in the fields, and then all the implementing partners, NGOs and contractors doing the work. That was the most consistent and ongoing conversation. How do you do the work better? And the other piece of the word was sustainability. How do you achieve objectives on a project, on a program in a given country that actually stick, right? How do you produce results that lead to, the first Trump administration, it was journey to self-reliance, which is another kind of, I don't remember the cliched expression, but I think under Obama, it was USAID forward, right? And the idea was, it's working ourselves out of a job. That's it's an overly simplistic way of putting it, but I do think it was consistently those are the two things that I heard most consistently, and that we would all be thinking about most consistently: how to be more efficient and effective, and how to achieve sustainable results.
Yeah, I had the same experience. I actually love the way that the first Trump administration put it, which was the purpose of foreign aid should be eliminating its need to exist, which I think is exactly right and what we should have been working towards. And yeah, I totally agree about the biggest critics of the way that we did our work were ourselves. We're absolutely an agency full of people who were constantly driven to look at the evidence, to see what could be tweaked, how things could be improved. And we were our biggest critics in terms of efficiency. I mean, I do want to keep it in the bigger picture. USAID was recognized as one of the most efficient agencies within government. I mean, for less than 1% of the federal budget, our program saved 92 million lives over the last 20 years alone. So it wasn't that we weren't efficient, but we were always looking for ways to improve.
Yeah, exactly. And that's exactly my point. I found the same thing. That's exactly my point. And your framing there is well taken, that, bigger picture. I mean, the Defense Department can't pass an audit to save their lives. It's just a reality. It's not a question of supporting troops and the work on it. It's not a question of that at all. I come from a military family, but that's a reality, actually, that when you talk about waste, fraud, and abuse and lack of efficiency, you can find. We could have found far better examples, but anyway, not to belabor that. Let's get into, all right, what happened? How did
Yeah.
it go down? And based on whatever starting point you think is most relevant.
Yeah, well, I guess it started on day one, on January 20th. Trump issued an executive order freezing all foreign aid. And I remember reading that and thinking to myself, this must be a mistake, because if you take this at its letter, that would mean interrupting clinical trials and shuttering health clinics that were open yesterday, and interrupting emergency ambulance services. It would have resulted in a lot of people dying, which like couldn't have been what was intended by an order that seemed to be quite reasonably suggesting that they wanted to reevaluate how the foreign aid portfolio fit within the new America First strategy, which seems like a reasonable approach, or it seems like a reasonable goal, but the approach just didn't make it. It seemed like it had been written by someone who didn't understand what we did in foreign aid, and so I just kind of like tried to hold my breath and say, wait, like there's a mistake here, and this will be clarified. But unfortunately, things got only worse from there. I think 5 days later, Secretary Rubio did issue some supplemental guidance, and then it was clear that my worst fears had actually been confirmed, because his order was to issue stop work orders to all of our contractors, and that was it. That was when our program stopped functioning. To talk to our partners or contractors, to talk to our sister agencies at CDC, to talk to host governments that were concerned about what was happening. So this was how the first week of the Trump administration began to unfold, and the way that it ended was even worse than that. When on the 27th of January, the Doge team came in and put the 60 most senior career officials at USAID onto administrative leave, just totally decapitating the senior leadership of the career civil and foreign service at the agency without any warning or notice. That was the backdrop on which I was, without any warning or advance notice, was promoted. I guess I'll use that term lightly, to be the assistant administrator for global health, the top position for global health at the agency. Walking into a situation where, our programs were frozen. We weren't allowed to talk to anyone about them. Our leadership was gone. And Doge was in our buildings, actually removing the pictures from the walls and taking the signs off of our doors, while Elon Musk was tweeting about how we were, Marxists that hated America and criminals, and it was time for us to die, and we were a ball of worms. And so this was sort of the stage that was set for me to walk into this position to try to lead global health. There was one positive piece of news that came out the same day that I was unfortunately promoted, and that was that Rubio issued a waiver to the freeze on foreign aid for life-saving humanitarian assistance. And this was kind of what it said was that while we're freezing all of our foreign aid, if it's life-saving, it can continue. And to me, this was kind of like, okay, that's the moment of sanity, that we don't actually want to let people die as we look at this, and there's going to be some interruptions, but we're trying to save lives here. And so as I was coming in, my thought was, this is my priority. This is the priority for my team. Can we restart our life-saving programs in accordance with this waiver, even as all this like crazy stuff is happening all around us? And maybe I'll pause for a second, but I'll foreshadow the fact that I was unable to at any point restart those life-saving programs.
And why? Why not?
Yeah, so I was stopped at every turn. I mean, it was between the Doge team that was working to break our systems, to shut our staff off from their email and fire them and put them on administrative leave, and the political appointees who had come in kind of with an axe to grind, that were quite vindictive and were happily tearing the agency apart and looking forward to getting rid of its staff. They had no room to listen to expertise when it came to the warnings and risks of the programs that had been frozen. I mean, just as one example, on the first time I was actually made that I was actually allowed to speak with our political leadership about what it was that we did in global health. This is the day after most of the entire staff in the Global Health Bureau had been put onto administrative leave. And I did a quick briefing with the chief of staff and the deputy administrator and the entirety of the political appointees that were leading USAID at the time. Just a quick 5-minute overview of the work that we did in global health, the infectious disease work, the maternal and child health work, the family planning work. And what I got was this kind of like stunned silence when I was finished. And the chief of staff said, "Wow, we had no idea you did all this." When I think of what USAID did in global health, I assumed it was just abortions. And I was just kind of like, I didn't know how to respond to that, because we don't do abortions. We do all these other things. And these are the things that they had stopped.
I don't know what my reaction would have been. I really don't. How would you characterize these folks that came in? And you don't have to use names, but you can feel free to use the names of people too. I think you do in your book. But
Yeah, absolutely. It was very important to me to list their names, because I do feel like these are people who are responsible for life and death decisions, and they did it they made those decisions out of ignorance, incompetence, and cruelty. And so these are people who are still sitting in high levels of government right now. And it was important to me to set the record straight about who was responsible for this. And, in my mind, one day, hold those people accountable for their actions. But I think there was basically three groups. There was the Doge group who really didn't care about what the programs were. They really never were interested in hearing about it. Their job was to follow Elon Musk's orders and as quickly and completely as possible destroy the systems within USAID. And they were probably the most effective, because they broke our payment system right away. They figured out how to get into our email server and just shut people off so they could no longer access email. That was creating problems with the second group, I would say, is those who had come in kind of as political appointees, and their job was sort of to they would say, draw down the agency as smoothly as possible. And by that, I think what it meant was keep things out of the headlines as they closed down our agency. And they recognized that there was this waiver for life-saving humanitarian assistance, and they expected it to be implemented, I think, but couldn't deal with the fact that Doge was breaking these systems. And part of it was because they didn't understand global health or international development. Part of it was that they didn't understand how government worked at all. So when problems arose, they had no idea how to fix them. And there was this one moment where I was explaining to them that if they interrupted, like one of the things that had stopped in the freeze was these clinical trials to test new drugs for multi-drug resistant tuberculosis, and that with those treatments interrupted, not only was that risking the lives of the patients involved, but also potentially the development of new strands of tuberculosis that would be not treatable by our antibiotics of last resort. I mean, this is an airborne infectious disease, and that's a threat to American national security. And they kind of did get that doesn't sound good. And they said, well, we got to restart that. But then I explained that our entire tuberculosis division at the time was on administrative leave, and they were just kind of they didn't know what to do. And the chief of staff, Joel Borkert, just kind of smacked the table and said, see, this is why maybe you can do this at Twitter, but it's not going to work here. And that was just one of many examples of how, the political appointees who were trying to smoothly close down the agency were unable to do that, even because of their inexperience, and as well as the fact that Doge was just wreaking havoc. And then there was a third category, which was those who kind of were the cruel political appointees, those who had come in. Most of them had been in the Trump administration, in USAID in the first Trump administration. Folks like Pete Morocco, or my boss at the time, a guy named Mark Lloyd, who just came in with an axe to grind and didn't hide the fact that they were looking forward to getting rid of USAID staff. In fact, my boss, Mark Lloyd, told me the first day we met that he was so angry with the career USAID staff because of how they had treated him the first administration. They had leaked things about him to the press. They had found pictures of his family and threatened him that way. And ultimately USAID staff had murdered his dog, he told me. And so these were kind of the people that I needed to convince to restart life-saving programs, and I just honestly didn't stand a chance. So I think those are a few examples of kind of the categories of the the people who were brought in to destroy our agency.
And I, this is not a like platform where I ever thought I'd be talking specifically and asking questions about delusional people, or I don't even know how to frame that, but just can I
Sorry to steer you in that
no,
direction.
no, this is good because it's the point is to tell the truth, right? It's a that's that is the main idea. Did someone kill his dog? Do you know?
You want to know something? That might be the most commonly asked follow-up question that I've received throughout this whole process. And sadly, I can tell you that nobody killed his dog. That doesn't sound like USAID staff. That doesn't sound like human beings. I don't think people kill other people's dogs, at least not people that I know, and certainly not people who have dedicated their lives to making the world a healthier and safer place. But and I didn't ask any follow-up questions of Mark Lloyd
Right.
when he told me that. I was so afraid that just like I didn't know how to respond to it at all, and I just kind of like sort of said, "Oh God, that sounds terrible," and tried to move on, hoping that I would just never have to
Right.
interact with this person again.
Right. I mean, I guess I can think about they're not, they're not people that I used to do any of this work with, I don't think. But I think about some of the people I've interacted with that are maybe a little bit off. You don't ask questions on stuff like that. You just kind of, try to keep things civil. I don't know. I guess not, I guess I get it, but
I will say, if I had known at that time that I was going to write a book about this, I would have said, wait a minute, can I hear what kind of dog, what are the details? And I would have actually liked to follow up on that, because it does sound like an interesting topic. And again, I've been asked about it many times, but at the time I was just like, how am I going to convince this person to restart these programs that are needed to save lives around the world? And like it just felt like such a steep mountain to climb that I
yeah,
I, I didn't get into it.
yeah. And I guess it's very difficult to digest, absorb, come to terms with what seems like the reality that the people that did this, it was obvious that many were malicious, right? And that's a reality, and especially you work around the world and you can see some crazy things. People all over the world, including the United States, could be really malicious, right? The, and I guess from being witnessing it from a different angle, and not as close to exactly what kind of where you are, but witnessing it all from a different angle and being somewhat in the middle of all of it. Those categories of people don't surprise me that you articulated. The incompetence piece always infuriates me because I think that's what we were so concerned with was, how do we do this work well? I have to be really good at my job. I have to protect the taxpayer money. I did it on the other side of the, or not side, the, part of the kind of delivery chain. You were in USAID. I was, at times in the field, at times doing it out of DC, managing field projects. But a lot, especially early on, that's what I was learning and doing, was protecting the taxpayer wallet. You're making sure that there's no waste, fraud, and abuse. And it's just it's not irony. It's worse than that, but that those were the terms used, and that it was just done by these people that are, many of them, as you say, are still there. They have no idea what they're doing.
Yeah, yeah. I mean,
And just
and
completely out of their depth.
the juxtaposition of watching them be the ones, this group of just totally unqualified and often uninterested individuals being the ones to get rid of the experts, to just walk the experts out the door for things that they just didn't even understand what it was that they were losing. It's not like they had done a calculus and decided we don't need to do these
Yeah.
things anymore. They didn't even know. And that was one of the most painful days. I was actually still working, but they held a day for the staff who had worked in our headquarters building, the Ronald Reagan building, who had been already removed, and they were each given 15-minute time slots to go into the building and bring a box or a bag and like get their belongings out of there. And just it was really, really painful and disheartening for me to watch as these people who had dedicated their careers and their expertise to these various programs were being kind of pushed out of the building by by a bunch of incompetent and unqualified people. And it really was painful to see them leave, just like watching the expertise we had built at USAID over all these years just leave.
And it's that. And the other thing that got me was, I don't think it's something I thought about very often when I was doing the work. And I was in the field at certain points in time and lived overseas doing the work. But compared to others, I know, and actually quite a few of the people that have been on the show, they spent a large portion of their careers or much of their careers overseas. A lot of these people risk their lives. And there's people, actually, the last guest I had was John Dunlop, who his last post was in the DRC, which is in the headlines right now. And we can actually talk about that, but where the Ebola outbreak is. But he was embedded in a military unit as a USAID person. He had a paramedic background before being at USAID. I mean, we could maybe plug for that episode, but for people to watch. But a lot of people risked their lives. A lot of people lost their lives too doing it. To be treated this way and to be dismissed I don't think I'll ever get past that myself personally. But yeah, I don't know, maybe that's a segue into, I think you've been out there speaking to this a lot. And I know people are asking you the question, what would USAID be doing right now if it still existed to prevent the spread of what is becoming another Ebola outbreak and pandemic?
Yeah. Yeah. I mean, I think it is a good segue because it was truly infuriating to see that your friends and colleagues walked out like this. But again, like that's only one small piece of the puzzle. The biggest, like the really saddest part about this is what's actually going to happen around the world based on those cuts. And I think that gets us into the Ebola outbreak that's happening right now, which is just one example of what happens when the U.S.'s global health leadership is ripped away without any transition plan or warning. And yeah, I mean, the Ebola outbreak right now in DRC seems to be completely out of control, and the U.S. response to it has been a massive disappointment, especially when you compare it to what USAID would have done when they were there. I mean, the policy decisions that I'm seeing the State Department make right now almost feel like it's the abandonment of our entire global health leadership, as we, rather than try to provide an effective response to rapidly contain an outbreak, instead the focus seems to have been even like just that we're going to try to keep Ebola out of the United States, and the travel bans that we're seeing, the failure to promise repatriation for Americans who could become sick with Ebola is doing nothing effective to hamper the outbreak, but instead is actually hurting the outbreak by making it more difficult to get a response, a effective response going. And if USAID had still been there, right, this was unfortunately would not have been our first Ebola outbreak. We had been dealing with them many times over the last decade or so, and had a playbook and knew how to respond quickly, both by deploying a disaster assistance response team within 24 to 48 hours, by moving pre-positioned PPE into the outbreak zone within like a short number of hours, working with the local partners that we have developed a relationship over decades with to do the real work for an outbreak like this one, where there's no vaccine or treatment, by containing the spread through contact tracing and community surveillance and risk communication and community engagement, which are just like things that the State Department has been unable and apparently uninterested in even attempting to pursue during this outbreak. And it's just sad because this was something that the U.S. government used to be a leader in, that people would look to coordinate a response and to provide the necessary resources. And right now it seems like we're in a retreat mode instead, and it's just such a far cry. It's so sad to think about how far it set us back in terms of Ebola response, but even more concerning in terms of like pandemic preparedness over the longer term for a disease that might actually become the next pandemic, not necessarily an Ebola, but perhaps like a respiratory disease or something that would threaten us. We just have completely retreated from the global scene.
Yeah. And I mean, when it's all of the prevention work that was happening is largely invisible, and it's like, we don't know, most of us don't realize, or most Americans don't realize how much went into preventing a pandemic. a global health crisis that
Yeah.
we can't escape from. And I know it's been said over and over again, but diseases don't recognize international borders. So we can talk about America first and being isolationist all we want, or person can talk about that all they want. It's it's just a simple scientific and common sense fact, or whatever you want to call it.
Right. I mean,
But
we used, sorry, go on.
no,
Yeah, no, I was just going to say that we watched in real time as the last year, as the Trump administration dismantled our ability to the early warning system that we had spent so much effort and money setting up since the COVID pandemic to ensure that countries had the capacity to detect and respond to emerging disease outbreaks before they became, major epidemics or potentially pandemics, and it was done again by people who didn't understand what they were doing. For example, we were told that even if we could restart life-saving activities, they could only be ones for which we could point to the individual who was going to die if we didn't do the activity, which meant that it was impossible to restart any surveillance or monitoring programs or any preparedness or prevention programs because that wasn't like this person has a disease and needs a treatment. That's like you need to be able to find like where the diseases might be before you can treat them. And because of that reason, all of our surveillance and monitoring program, that whole investment that we've made, came to a screeching halt and was never even considered for restarting because of this simple like misunderstanding of how public health works.
well, and I can tell you were probably really good at your job because you said that very diplomatically. I was never in a diplomatic position really of any kind, well, for the most part. And that feels to me like a person or these people that came in who are like, I'm a Philistine. I'm a simpleton. I don't understand this. And if I can't understand it, I'm going to break it and get rid of it. I'm going to throw my refrigerator out in the alley and just get rid of it because I don't understand how the mechanics work to cool the food. It's like, you know, I don't understand how my refrigerator works in mechanical detail, but it works.
Yeah, I mean that's actually a good analogy for what was happening there. I mean the other, maybe the only thing I'd add to that is that there was this kind of like deep-seated mistrust. They had their preconceived notions about what USA did. It did abortions, right? And it like was like trying to subvert the president's priorities, right? Those were the things that these people had heard that it had did, and so there was no room to listen to or trust or kind of like access information from the career experts that were there. I mean, at one point, there was an Ebola outbreak happening during that time in 2025 when I was there as well, and we were unable to restart any of our programs. And at one point, a guy named Tim Meisberger, who was the political appointee responsible for humanitarian assistance at USAID, told us that he wasn't going to restart any Ebola activities because Ebola is quote because Ebola is a scam. And that just goes to show you, right? Like we were not prepared to have that kind of conversation or to explain like that infectious diseases are truly threats, right? Like we were mired in like comparative analyses and like the best way to
Sure.
implement different programs. We were just like totally caught by the level of indifference and ignorance that we encountered.
Well, and those sad stories, we saw that happen during the pandemic here. People who were convinced and brainwashed into thinking that it wasn't real and then died. And I think it's very it's I don't know what else to call it. It's so unsettling and disconcerting that anyone can be brainwashed like that. Um, and to just get sucked into all that paranoia and to create things or kind of create this alternative reality that's just in the clouds. For those people to end up in positions of significant power and influence and control is, I don't know what else to call it. But what can I ask, and I'm shifting gears here, what made you decide to to write this book, to become essentially a whistleblower, or maybe like actually maybe just ask was, when did you actually leave USAID through all this?
Sure, sure. So yeah, I can kind of try to put that together a little bit. So after several weeks of trying and failing to restart life-saving activities as the political appointees and Doge broke our payment system, put our experts on leave, like continued to narrow the definition of what life-saving looked like, and then ultimately terminated all the contracts that we would have needed to do the work. Ultimately, I realized that we were not, that this was I could not say our priority for our staff was to restart life-saving humanitarian assistance. It was not a possibility. And instead, I realized that our number one priority was actually to bear witness to what was happening and everything that we had tried to do to restart programs, and yet how we had been stopped at every turn. And I think maybe a last straw for me was just standing and watching Elon Musk at the White House lying about Ebola activities having been restarted when it was the same day that the contracts we would have needed to do those activities were terminated, that I realized that I needed to tell the world what was actually going on there. And so in like the last few days of February, a small team and I put together a series of memos that basically documented every step we had taken to try to restart our programs, how we had been stopped and by whom along the way, and then a warning of what the impacts of what that destruction was likely to look like in the world. Sent those out on March 2nd, and that same day I was placed on administrative leave, and unfortunately that was the end of my career. Remained on administrative leave for a couple of months, and then my position was eliminated. And a couple of months later, kind of decided that I needed to expand on this story and sort of because I really needed to name names. I hadn't provided the context, and I really wanted to share a bit more about trying to show what it looked like from the perspective of civil servants that were faced with these sort of impossible choices as the programs that we had devoted our careers to were being destroyed, and kind of to show what does it look like when you have to when you're put in that position and kind of like need to decide how you're going to respond when what you're seeing is just totally unacceptable and often illegal and definitely unethical. And so I decided, because my memos had been just very like dry and like almost like a chronology of exactly what happened, that I needed to kind of like expand on that story to maybe serve as a warning as we see other potential institutions at risk of like what that process was like at USAID, and maybe it'll serve to be helpful for others.
Yeah. Well, I'm glad you did it, and I appreciate it. Yeah. One thing, the small kind of glimmer of hope that I've found recently was the fact that your book got on the New York Times bestseller list, because it can't just be sympathetic former aid workers that are buying and reading the book. If that's the case, the numbers wouldn't add up. There aren't that many of us. So it sounds like there's still a fair amount of Americans who care about this. And it's somewhat reassuring. I don't know if you see it that way. You may not see it that way, and that's fine. That was despite all my cynicism, that's, as bad as it's ever been these days, that was my positive kind of reaction to seeing that this many people were reading your book. But what was your reaction?
Yeah, I mean, I was surprised. I was surprised since the day I was put onto administrative leave when I sent those memos out. I have been surprised by the reaction, because prior to January 2025, most Americans really neither knew nor cared about USAID and what it did. It was just kind of like, if they had heard about it at all, it was just kind of like this small thing that didn't really affect their lives. And so I was like shocked to get reaction from like major news media in March of 2025 when my memos come out, and I've been absolutely shocked by the reaction to my book as well, because I do think that like one silver lining of the way that USAID was destroyed, and the fact that it was really the first kind of like federal agency to be attacked by Doge in the way that it was, really did bring attention to what it is that we're losing in a way that I don't think most Americans ever really thought about before. And I do that also gives me hope, is that just the idea of like the massive destruction and the millions of lives that are put at risk by the decisions that are made by people who didn't even understand what it was they were doing, what wasn't even really like a policy path, I think has like maybe raised the attention and awoken many people to the value of the work that USA did, and I hope that continues, and yeah, I'm very pleasantly surprised by how many people are picking up this book.
Yeah, no, it's great, Nick. Good work doing it. I honestly, at least from my standpoint, is there anything else you wanna share kind of before we move to concluding?
I don't think so. This has been quite a conversation.
Yeah, thanks a lot for joining and kind of sharing the story. I've probably said it too many times. Once again, and thank you for your work. Thank you for the work you did before this disaster, this unnecessary disaster came upon us, and for documenting it and putting it down in this book. Nick's book is Into the Woodchipper. Nick Enrich, thank you so much for joining us. Alex Natsio signing out from Unsung Americans. Please like, subscribe, and share, especially with your skeptical friends and family. Thank you very much.